Hello, my name is Victoria Kress, and I am the coordinator of the Clinical Mental Health and Addictions Counseling programs at Youngstown State University. Integrated care, and as a part of that, collaboration and consultation, are an important part of the emerging behavioral health landscape. Counselors play an important role in contemporary emerging integrated care models. In this module, I will be providing information related to integrated care. More specifically, I will be discussing how counselors can work collaboratively with various physical and mental health care providers to provide comprehensive, quality client care. This module was created as part of the Impacts Grant Program, which was financially supported by a grant Youngstown State University received from the Health Resources and Services Administration of the U.S. Department of Health and Human Services. Integrated primary care has to do with counselors and primary care practitioners, such as physicians, nurse practitioners, or physician assistants, working together in one agency to provide both counseling and traditional medical care under one roof. Integrated care is helpful to clients and important. When working in an integrated care setting, counselors and primary care practitioners are able to quickly and easily refer clients to a number of different services located in one co-location. Because of the closeness and proximity, counselors and primary care professionals are better able to consult and monitor clients' progress and identify needs that may need to be addressed. Working as a team of professionals in one location ultimately helps enhance client or patient care. There is also a greater emphasis and focus on unified goals and a comprehensive treatment plan. In addition, integrated care settings are often preferred by clients because there is a reduction in stigma associated with going to a mental health agency. Counselors play an important role in integrated care. Counselors help patients or their clients deal with a wide variety of psychological struggles. Most commonly, counselors in integrated care settings work with clients around issues associated with various mental disorders, such as depression or anxiety or perhaps trauma. Counselors also work in these settings to help patients and clients manage life stressors and adjustments. For example, helping a client who is going through a divorce and having physical and mental health problems associated with that divorce. Counselors may also help clients and patients manage any other stressors that may emerge, such as the loss of a job or the death of a child. Another common issue dealt with in integrated care settings is substance abuse. Counselors play an important role in motivating clients to change their use of substances. When working in an integrated care setting, counselors are able to see the full range of psychological challenges that people experience in the context of their physical illness, their phase of life issues, as well as in association with their psychiatric and substance abuse disorders. As an example, consider a woman who is in a domestic violence relationship. She may be navigating a number of different physical challenges, but she will also have a number of psychological needs that may need to be addressed. In this situation, a primary care practitioner and a counselor can work together to best meet her needs in one location.
When it comes to healthcare, there are many ways to get care. There are organizations that provide different care for different needs, like primary care centers, ERs, dentists, pharmacies, and behavioral health centers. When you have multiple health issues, you traditionally have to set up multiple appointments with these different specialists. Sometimes, people get help for only some of their concerns. When that happens, it's hard to get well. Although certain concerns may seem unrelated, they are all part of a whole person, a system, and it's hard for the person's healthcare provider to help them reach whole health and wellness unless they are aware of and know about all of the concerns. When they know all concerns, they can help the person decide which options for care may be more effective. There's a new approach, integrated healthcare. For people with multiple health concerns, including mental illness and addiction, healthcare providers are adopting integrated care practices. That means they are teaming up with other healthcare providers to increase access to primary and preventative medical care, mental health care, addictions treatment, and sometimes dentistry, offering coordinated care, sometimes even in the same office. Community health centers and behavioral health centers are beginning to work together to provide services as a team and screen and refer people to each other's office for the services needed. A growing number of integrated care providers are in the same building. What does integrated care look like? Let's take a look. Meet Wendy. Wendy doesn't feel well. She has diabetes and bipolar disorder. Lately, Wendy's been sad and drained of energy. Last month, Wendy was in the hospital for complications from her diabetes. Now, she needs to refill her medications and wants to see someone about how she's been feeling. She could go to a health clinic to see a doctor or nutritionist for her diabetes, a separate behavioral health center to see a counselor and psychiatrist for her bipolar disorder, and then head over to the pharmacy to pick up her medications. This time, Wendy is going to a place in her neighborhood where she can get primary care, mental health care, and addictions treatment. When Wendy gets to the center, she meets Renita, the receptionist. Renita helps Wendy enroll in the center's care. Wendy tells Renita about how she was just in the hospital, and she tells her why she's come in today. Wendy explains how depressed she feels, how she wants to talk to a counselor, how she needs a psychiatrist for her mental health medication, and a doctor for her diabetes. Renita gives Wendy a screening form where Wendy shares that she drinks heavily but would like to stop. Renita explains to Wendy how at their center she will have a caring team of professionals all at the same location to help her achieve her health goals. Renita then introduces Wendy to Nathan, the nurse. Nathan takes Wendy's blood sugar and is alarmed at how high it is. Wendy explains that she hasn't checked her blood sugar for a week because she doesn't own a blood sugar monitor and can't afford one. Wendy tells Nathan that she'd like to know how to take better care of herself. Nathan checks with Wendy's health insurance and sets up an appointment for Wendy to see a doctor on that same day. Wendy then sees Dr. Dynamite. Dr. Dynamite gives Wendy a physical, and while she's doing that, Wendy talks with the doctor about her bipolar disorder and diabetes. Dr. Dynamite is concerned about Wendy's worsening symptoms of depression and steps out of the room to call a consultant psychiatric provider who suggests an increase in Wendy's antidepressant medication. She then writes Wendy a new prescription for her diabetes medication and the change recommended by the psychiatric consultant, and suggests that Wendy meet with her colleague Louise to talk more about her bipolar disorder. Dr. Dynamite indicates that she will also talk with Louise about Wendy's diabetes so that everyone is on the same page. She asks Wendy to check in with Nurse Nathan every day that week so they can together monitor her blood sugar. While Wendy is waiting for Louise to come into the exam room, Nathan talks with Wendy about managing her blood sugar, eating right, gives her tips to drink less, and advises her about her medication. Nathan then introduces Wendy to Louise, the center's licensed clinical social worker. Wendy feels comfortable enough to share her experiences and talks with Louise about her recent symptoms. Louise asks Wendy if they can meet on a weekly basis to start. Louise asks Wendy if she'd like to meet with Pia, a peer counselor. Louise explains that peer counselors are individuals on the care team who have experienced getting help for a mental health or addiction concern themselves and are trained in helping people who are working toward recovery just like they have. Wendy agrees that she would like to meet with Pia. Louise also gives Wendy a list of some nearby support groups that can help Wendy reduce her drinking. Nathan, Louise, Dr. Dynamite, and the other professionals that help care for Wendy at the center each note the outcomes of their visits with Wendy in one electronic health record. Before she heads home, Wendy chats with Nathan, who will work with Wendy to ensure she continues receiving regular care. Then there's just one last stop. Wendy stops by the on-site pharmacy to pick up her prescriptions. All of Wendy's new caregivers talk about Wendy's progress in regular morning meetings. Nurse Nathan regularly checks on Wendy to make sure she has what she needs to manage her health and to feel better. Wendy is more confident in talking about her behavioral health and medical issues with Nurse Nathan, peer counselor Pia, and LCSW Louise. They see Wendy regularly to make sure she's feeling better and educate her how diabetes can sometimes worsen feelings of depression. Wendy now checks her blood sugar daily, takes her medication on schedule, and eats carefully. She is drinking less each week and is talking about giving up alcohol altogether. She attends a nutrition class at the center and walks every day to lose weight and to help control her diabetes. Her blood sugar is controlled, and with counseling and support, her symptoms of depression are reduced. Since starting this new integrated care, Wendy hasn't had to visit the emergency room or go into the hospital. Wendy is on her way to wellness.
Counselors serve an important function in integrated care settings. In these settings, counselors provide education to the medical team relative to issues with which the client is struggling. They may provide information related to intervention, and they may also engage in behavioral health assessment. Counselors also provide education to patients about prevention and the early identification of behavioral health symptoms. Counselors may also screen and assess patients for various mental health disorders, including substance use disorders. Counselors may provide brief psychotherapy or counseling in integrated care settings. Counselors often can serve an important role in terms of crisis intervention. Counselors also can be involved in these settings in dealing with complex cases and determining if higher levels of care are needed than what can be offered in the integrated care setting. Counselors also play an important role in integrated care in supporting caregivers and how they can have healthy, productive, adaptive interactions and positive communications with their family members. The integrated care setting is unique. The integrated care setting provides an opportunity for increased collaboration in one location where multiple providers practice. Primary care settings are often the gateway into behavioral health intervention. As such, having primary care providers and counselors in one location can more easily get patients to receiving the mental health supports and resources that they need. In these settings, counselors are able to quickly jump in and help people receive the mental health services that they require and screen for higher levels of care. In an integrated care setting, there's a great deal of collaboration that occurs between many different professionals. These may include primary care physicians, nurses, physician assistants, or dietitians. In an integrated care setting, clients are able to receive a comprehensive treatment plan in which their goals can be met effectively and efficiently. There are many benefits to having counselors working in integrated and primary care settings. Most importantly, integrated care settings provide consumers with one-stop shopping where they are able to receive all the services they require in one place. As a result of this convenience, there is often better follow-up on counseling and behavioral health services when clients are able to receive all of their services in one location. Additionally, there is better monitoring of treatment that occurs when there are multiple providers working under one roof. There's also increased communication between the primary care professionals and a counselor in these settings. There is reduced stigma for the patient or client when receiving services in a more comprehensive setting. Many clients feel uncomfortable reaching out or attending sessions at community mental health centers because they fear that they may be recognized or somehow embarrassed or shamed. Additionally, many patients who have severe mental health issues struggle to get the medical care that they require. And because of this collaborative stance that is involved in integrated care settings, patients are better able to receive both physical and mental health treatment. Research suggests that there are a number of positive outcomes associated with integrated care models. For example, consumers often experience decreased depression, a decrease in perceived distress, a decrease in anxiety. Consumers also tend to prefer to see their primary care providers and counselors in one setting. Finally, integrated care produces improved clinical outcomes, increased client and provider satisfaction, and improved cost effectiveness.
We look at suicides in the United States. There's 40,000 suicides a year. That's twice as many as homicides. It's one of the leading causes of death. But the stat that jumps out at me are two. There's 64% of these patients saw their primary care physician a month before taking their life. I think stigma played a huge role of them not asking for help, but 38% saw a healthcare professional within 7 days of taking their life. One study says 70% of primary care physicians feel that all their appointments are psychosocially related.
The struggle in primary care is trying to manage the medical problems of a patient when they also have an underlying behavioral health issue. It is difficult to manage the medical problems and then enter the realm of behavioral health.
So I think it starts off as to why we started the behavioral health integration program. Long story short, it's a way to improve psychiatric access to where the patients are. We want to meet and support primary care providers and their patients in their clinics. It gives us an opportunity for our team to see these patients while the provider is able to keep going and see their own patients at their other rooms. When we look at the process, one of the things that we took into account is try to make it as simple as possible for the clinic, be minimally disruptive to the provider's flow in that facility. We have to make it as simple as a phone call and an acceptance of a video. Let everything else fall on our team. That way the primary care physician can focus on what they need to focus on, which is patient care.
So the ability to provide the service in behavioral health while the patient is sitting in your office, while they're captive, and while they have had the courage to open that door with their primary care physician is just a golden opportunity that we're now able to execute. And when we take care of that part of the patient, it's a whole lot easier to manage their medical problems.
We screen for depression primarily because depression is the most common mental illness. But what we tell our providers is the referral criteria is if you wish you had someone there, give us a call. We don't focus on just depression, we focus on any mental illness that the provider needs support on. We have an extensive callback protocol. Most of the times if a medication was started or if the patient had unfortunately negative thoughts of wanting to hurt themselves or hurt someone else, we follow up with that patient within 24 hours. And we want to support them through that process. And we also call them in intervals of 2 weeks. During this time, we're assessing, providing psychoeducation to the patient, seeing how they're doing with their medications, are there any side effects, but all the time staffing these patients through our twice-a-week treatment teams and making further recommendations.
It really is an amazing service, and it is so little time added to the provider. It actually just gives you time back, and I would say embrace it, give it a chance. If you have any questions about it whatsoever, come follow me around for a day, and I will show you how amazing it really is.
I think it's made primary care providers feel reassured that when they open Pandora's box to mental illness, there's going to be a team there. Many providers have told us that they feel that it has sped up their practice, primarily because they can continue to see all their patients that are scheduled while a professional team is seeing their behavioral health patients.
Jump in with both feet and embrace this.
So why do we do this? Why do I think this is important? Is if we can save a life, this pays for itself.
There are various models of integrated care. The model used in any given setting will be dependent upon the unique needs of the individuals and populations targeted and served. There are two general ways of thinking about integrated care models, and these are targeted integrated care and non-targeted integrated care models. In targeted integrated care, specific populations are targeted and addressed. So as an example, if somebody is interested in serving substance abusing pregnant women, an integrated care setting would provide physical and mental health care specific to the needs of substance abusing pregnant women. Non-targeted integrated care models involve practicing and providing a broad array of services to clients with various health-related needs and concerns. So these are not targeted or specific to any one given population. As an example, there might be an independent family practice that has, say, a primary care physician, nurse practitioners, and counselors all working in one setting to address a wide variety of client and patient needs. In non-targeted integrative care settings, close collaboration occurs between primary care professionals and mental health professionals, and they consult regularly about different and varied client concerns and possible intervention strategies. Mental health professionals in these settings often take on a case management role or approach in addition to providing more traditional mental health assessment, diagnosis, and treatment. Primary care professionals in these settings remain in charge of the patient's physical well-being, while the mental health professionals assess for mental illness, and they link clients with appropriate services and provide, most typically, time-limited therapy and counseling. In non-targeted integrative care settings, close collaboration occurs between primary care professionals and mental health professionals, and they consult regularly about different and varied client concerns and possible intervention strategies. Mental health professionals in these settings often take on a case management role or approach in addition to providing more traditional mental health assessment, diagnosis, and treatment. Primary care professionals in these settings remain in charge of the patient's physical well-being, while the mental health professionals assess for mental illness, and they link clients with appropriate services and provide, most typically, time-limited therapy and counseling.
An essential feature of integrated care is that we are measuring health outcomes, not services. So I've changed the language that I use, and indeed we've changed the language in our organization from services to care.
He might still be in the hospital, actually.
Oh, really?
He's,
Okay.
he's the one who has cancer, and last I knew.
When somebody comes to us, we don't often talk about integrated care. We practice it. And what that means is that we respect the fact that individuals bring with them today's crisis at home, trying to get the kids ready for school, financial problems, housing problems. When people come to us, all of those pieces are swirling around within. So what people get when they come here is attention to their entire spectrum of needs.
As we've evolved and been open longer, it just is what we do. So we're not doing something different. This is our care. And we're better at introducing that this is our care. And I think when we feel confident and it is part of business as usual, not an experiment, not something different that we're doing, we begin to see it as something not different. And our patients experience it, oh, this is just what they do at this clinic.
My name is Shannon. I'm here seeing my regular physician, Devin, who I've been seeing for about 2 years now. And when I started at Clinica, she was my first contact person. Devin's always there for me. She's called me, I've called her, she calls me. We check in, and so, you don't feel neglected. It's like it's a group effort to look out for each person, and in doing so, it's like the whole of it is who you're here to see.
Integrated care is particularly important for a population like the one that Clinica serves. So if we can provide all the services they need at the one time they come in to see their doctor, it's more likely they'll get what they really need. We can bring to their one visit, a visit with a hygienist, a dental hygienist, and even behavioral health services, all kind of one-stop shopping.
Integration at its best is very patient-centered and engages patients as partners in the team for the betterment of their own health care.
Essentially, it enables the patient to be able to coordinate their physical health care that they come to the doctor normally for with the opportunity for mental health care.
In doing so, I am a more active leader in my own care, because we talk about things, whether it's Sam or Deb, we talk about it and then we see which direction we want to go. It's nice because it's like I know every time I come in, I'm like, oh, I'm seeing Devin and Sam today.
I like to meet most new patients so they know that I'm part of the care team, that they have this mental health service in addition to their health care. And after I talk with the primary care provider and get a little history, I will go in and say, hi, my name's Sam, this is what I do here, and I just want you to know that you can reach out to me. I think in terms of outcomes for the patient, if you have a team that is more cohesive, that's treating you as the patient, I think that translates to better care, as well as feeling more comfortable knowing that you have all these great people that are helping you together.
About 3 years ago, we started having hygienists, dental hygienists, come onto the pod. And we thought that was really important because medical care is difficult for people to get. Dental care is even harder. It's more expensive. It's the kind of thing you don't think about until you actually have pain in your mouth. And we wanted to help prevent that for our patients.
What we need to do is develop a system where we get paid for the patient's health and we get held accountable for the patient's health. Not the services we provide, but their improved health. As we have established integrated care in our communities, among the biggest challenges in public perception has been that we are here only for poor people.
In thinking about integrated care models, there is a special place for integrated care in the context of youth counseling. Youth and families may benefit when they are able to see a counselor at a pediatrician's office. Pediatricians often make referrals for youth because they see a wide variety of behavioral health related issues, for example, defiance or temper tantrums. Additionally, pediatricians may see issues associated with attention deficit hyperactivity disorder, trauma, or maybe even family adjustment issues. Because pediatricians so frequently refer patients to receive behavioral health counseling, having these services provided in one location can be very advantageous to youth and families. The in-house counseling approach may enhance the youth's ability to receive services, and it may also enhance youth and family follow-through on receiving services. It also provides a reduction in stigma for youth and families as they are able to see their counselor or behavioral health professional in a pediatrician's office. As such, this idea of counseling or receiving mental health support becomes normalized for the youth and his or her family. In our society, there exists a number of racial and ethnic disparities in relation to accessing both physical and mental health care. There are a wide number of reasons that this may be the case. There are discrepancies in terms of insurance coverage and access to insurance coverage. There are also various cultural-based understandings associated with help seeking, with some cultures believing that it is best to keep problems within the family and not talk to people outside of the family about various problems in living. Many people, too, feel very comfortable talking with family members or maybe a physical health provider, but not so much a mental health provider. There is also a tremendous amount of stigma for people from many cultures when they think about talking to a counselor or a mental health provider. In order to reduce some of these disparities, integrated care has come up as an important possibility that can be used in addressing and intervening around these issues.
It's been quite successful. Patients are able to be seen at the time that they're admitted for their medical conditions. And in surveying those patients, we've learned that had they not had that opportunity to see an embedded clinician, they would not have sought separate behavioral health services. For our younger patients, our adolescent and teenagers, we're looking at such problems as failure to attend school, substance abuse, bullying, anxiety, the young emerging adult issues. We're very excited to be beginning some new group programs for our younger patients. There are tremendous benefits to having behavioral health consultants in the primary care setting. Greater access to care for patients is a key factor. Patients no longer have to wait to receive behavioral health care. They can have same-day access with a provider that's sitting right next door. We know that some patients have expressed that they would not have sought out behavioral health care if they had to go to a separate provider. So we're reaching many more patients early in the course of their treatment before their issues escalate into something that may require hospitalization. And we're hoping that by being there, we're preventing hospitalization, preventing worsening of their conditions, and preventing relapse. On the outpatient primary care side, we have embedded behavioral health consultants who work directly and seamlessly with the primary care provider, seeing patients that have concurrent medical and behavioral health diagnoses. We know that many patients that come in with medical issues such as diabetes and cardiovascular disease and pain also have anxiety and depression and substance use disorders. So we meet with patients, we collaborate with the attending physician, and try and come up with a team approach to the care of the whole patient. This is true patient-centered care, seeing the patient in the primary care setting. The primary care physician is responsible for the care of the whole patient. We are coming to them, we're coming to the patient, and seeing the patient as part of a team. So behavioral health is now physically a part of the team that treats the whole patient. We feel that this is a key factor in providing access and greater services to our community.
As counselors think about practicing in integrated care settings, there are different tips that they can consider. First, they need to gather the skills and competencies that they need to be successful in such settings. Being comfortable and prepared to work in a fast-paced environment can be helpful, and understanding what the various issues are that often emerge in primary care settings is also important. Counselors who aim to work in integrated care settings should also be comfortable working with people who have a broad array of presenting issues. They should also be comfortable working in a non-traditional setting and thinking outside of the box. They should also develop a good working relationship with the team and be able to be good team players. They should also be comfortable working within a biopsychosocial model of care. In other words, they need to be able to think about clients from a biological, a psychological, and a social angle. Counselors who want to work in integrated care settings should also learn how to work with a variety of populations and people who present with many different issues. So, for example, working with children, older adults, or those from various cultures is important.
So I'm Dr. Daniel Brown, the Chief Medical Officer of Meridian Healthcare. We have a integrated program with primary care embedded in the behavioral health agency.
So Dr. Brown, what would you say is the role of a primary care physician in patient care?
I think primary care physicians have changed over the last few decades. It used to be that your primary care physician was pretty much your go-to doctor for everything. And now primary care providers have become more of a home for that person's medical records, that person who is your interaction between your pharmacy, your insurance. There's a lot of things that go to it that are more of, I don't know how to say it, more paperwork driven, things that are just requirements now. But I think the role of the primary care physician specifically hasn't changed a whole lot. Our job is to help people kind of navigate the healthcare system, to be able to link patients into the appropriate services that they need in the community, in the hospital, with specialists. And I think it's really, that hasn't changed a lot, but our overall role has changed in our interactions with patients and their health insurance.
So going along with that, how would you say that your role as a PCP is unique from like a specialty physician?
So primary care doctors, this is my mentor that I had going through residency, Dr. Dewar at Northside, was fantastic in really describing this, that as a primary care physician, you have to be comfortable knowing that you're not a specialist in any one thing. You're a specialist you're specialized in knowing a lot about everything, but you can't specialize in any one. I mean, 100 years ago, a doctor was just a doctor. Everything we knew about medicine could fit into a few volumes. And now it's, everything we know about endocrinology can fill this room. So your job is to know the 10 most important problems that probably in each field, be able to work with those 10 problems pretty easily, identify them, treat them, and then also be able to identify the less common things and get them to the appropriate people. So I think that as a primary care physician, you have to be comfortable saying, I don't know, but I know that it's in this realm and I can get you to the right people. And you should be but you should also be very good at dealing with the common problems that walk through your door every day.
Such as maybe mental health. So as a PCP, what would be your role in supporting the mental health needs of your patients?
Some programs train primary care very well with mental health services, some do not. And I've seen it really, physicians, as they come out of different residency programs, some are very comfortable with it, some are not. Fortunately, where we were, we did spend quite a bit of time working in the behavioral health unit. And I think once you're out into private practice, in primary care, your job should be really to screen people, to identify mood disorders, to make sure that you're identifying people who are consistently seeking medical care for issues that are maybe being driven by anxiety, driven by depression. So we know that a lot of patients who seek medical services over and over again have fears that they're going to die, that they have cancer, that they have this and that. And when you can continue to do test after test after test, only to find out that they're never getting better because you're not identifying the core issue of, you know, that person's underlying mood disorder. So,
Very good. What can you say about, I guess, like the behavioral health care models that support the integration of primary care and behavioral health to, say, a student in a counseling program? How could you help them?
Well, I think you have to think about it in two different ways. There's behavioral health agencies like ours that we integrate primary care. There's less information on those models because less support for it, because really when the studies are done, they're looking at how do we save cost, you know, and improve outcomes. Well, usually when you're looking at improving outcomes, it's much easier to prove on the medical side. So when a primary care office takes and embeds behavioral health, and they do the screening, they do the SBIRT, the screening, the brief intervention, referral treatment, and you have a counselor right there intervening, you can really save costs and you can improve patient outcomes and eliminate unnecessary testing. On the behavioral health side, all those patients in our agency already have a diagnosis. They already have a mental health diagnosis. They already have been screened for substance use disorders. So what you're doing is you're taking those patients and you're trying to engage them in primary care services to take care of their chronic medical needs. And what we found is difficult is that engagement is a little more difficult on that side, taking those patients who are there and getting them to engage to address chronic medical needs. And so when you look at the different models, the impact model was probably the first one that came out on the primary health care side, embedding behavioral health specialists there to you know, to screen patients and do the brief interventions. On our side, the only thing that really shows a true benefit is if you can get complete integration where you have a team working together with primary care, the behavioral health side is working together, and that honestly, almost at the point where you have a joint treatment plan where the person's chronic medical needs are addressed in the treatment plan, and everybody's kind of working towards those same goals.
How would you explain the difference between like a health home and an FQHC versus integrated care? I think a lot of students, they hear these terms and they don't always know the difference.
Yeah, I think when you look at, so an FQHC is Federally Qualified Health Care Center. They actually receive grants to provide primary care for people. Their initial role was to provide care for people who didn't have health insurance. And so they got improved Medicaid reimbursement rates for those who were enrolled. In exchange, they had to take people who were not. Well, now that has completely changed with the Affordable Care Act, and pretty much everybody has insurance. Now you're seeing them more go towards a patient-centered home model. They really, the idea behind that is that you can track the patient's entire life cycle through the healthcare field, through one centered chart on that patient. Integrated care is more of an idea, it's more of like how you interact together. If you say you're an integrated program, we may not have everything that a full granted FQHC may have, but what we strive to do is try to create a culture of integration where people pick up the phone, people call each other. For us, the way we would gauge it is that the person who walks through the door sees their primary care provider and their behavioral health provider as one provider. They see us as one team, fully integrated for their care. They don't think of us as separate units.
So it sounds like a lot of times with integration, they're kind of, it's few and far between. But so as a counselor who's maybe working in community mental health that doesn't have an embedded primary care practice, how can they work with a client's PCP in order to create better behavioral health outcomes from maybe a distance rather than on site?
So there's you know, obviously outside of just a standard referral and sending letters, a lot of times personal communication is the best way. And I think sometimes counselors I've seen are afraid to pick up the phone and call the doctor and talk to them directly. And I can tell you that from physician to physician, that's what we do. We pick up the phone, we call and say, hey, this patient here, we're going to do. And then there's the communication via letter or whatever, so that it backs it up. They still have the written stuff, but we have that personal contact. So don't be afraid to call and talk to the primary care provider, especially if you see something that you think they need to address or would be beneficial for the patient. I think that's probably the main thing is really just to communicate. And when you communicate, I think that's the other question is like, how can we communicate better? You know, it's, you know, communicate with, think out what you're going to say before you call. You know, this is a patient so-and-so, and this is their diagnosis. And physicians are kind of used to hearing things in kind of a scripted way, and sometimes it's good to learn how to present patients.
Absolutely. So speaking in terms of diagnostics, symptoms, concerns, and being able to communicate that fluidly and readily, and not having to flip through a chart and
Right. You know, you kind of start off with a very specific. You know, my patient is this patient is 20-year-old with this diagnosis, presented today with these complaints. This is what I'm finding. This is the diagnosis or my impression for today, and the reason I'm calling you is for this. You know, be kind of specific, and you'll get a great response. Sometimes people call up and you know, you may get some real vague things. You're not really sure what they're asking, and then you know, if you get somebody who's kind of in a hurry, they're seeing multiple patients, you'll get a different response. So I guess present it in a way that you're clear about what you're asking or what your you know, what your concerns are, and you'll get a good response.
Could you share an example of a time maybe somebody hasn't communicated effectively with you, a counselor hasn't communicated effectively with you, and
you know, we used to have referral forms where people would fill them out and send them over to primary care, and we would have counselors at times not want to do their homework and say, you know, not actually assess the patient or give a diagnosis or give their impression. They would just say, you know, evaluate for psych meds. I actually had that written one time, and I was like, you know, come on, we're more professional than that. So, you know, what did you see? What were, you know, do you think the person has depression? Maybe they have anxiety. You know, what is it that you're seeing that makes you think the patient needs medicated? And you know, and give me some more information. So I think that's the main thing. Is as busy as you are, you know, it's if you're seen as just kind of passing things off, you're not going to get a good response. So.
Can you share an example of a time, maybe two examples, one where you saw communication with a counselor move towards effective outcomes for a client's mental health goals, and maybe on the AOD side as well? Maybe two examples.
Yeah, I'm trying to think of, you know, a really good example was one of our, in fact, it would be probably kind of the same issue. This is a patient who's in our co-occurring treatment program, had a fairly low level of function. I can't remember what their exact diagnosis was, but when they were going to the counselor in the co-occurring treatment program, she asked the question, how are you dealing with your medications? Are you seeing your doctor? And the patient reported some concerns about the medication, that they were a little confused on what they were taking. And so recognizing right away that this is something that shouldn't wait, the counselor picked up the phone, they called me, I got in contact with the person's nurse practitioner, it was their primary care provider, we pulled the patient in right away. So it was like direct communication, two separate, even though we were at separate sites, we pulled that person in that day, sat them down, found out that the person had been admitted to the hospital, was discharged, went to an internal medicine clinic who gave them duplicate medications. The person was on 2 different blood pressure medicines of the same class, 2 different diabetic medications in the same class. And if that counselor wouldn't have asked that question, it wouldn't have picked up the phone, wouldn't have done what she did, it probably could have been catastrophic. So it's very important. You don't have to know a lot about medicine to make a huge impact. If you just ask the patient how they're doing, or they're seeing their doctor, and if they have, you know, and all she didn't know, and she didn't know this blood pressure medicine from this one, all she knew is the patient was confused, and she made the phone call.
Excellent.
So.
I guess, you know, knowing that these are students in a counseling program that are learning how to interact with PCPs and understanding integrated care, outside of communication, is there any other advice that you could give them in working effectively with physicians on mutual cases or referrals?
No, I honestly think really that communication is the key. Building those relationships, I guess, which is all through communication. Charting well, you know, making sure that, you know, we do read your chart, we do read your notes, you know, and so, and when the things that you send to us, as far as for us to review, we go through that. And so, if you're really short and you don't express concerns or what you're seeing, unfortunately, I see way too often people have little paragraphs that they just drop in there, that they cut and paste in, like, met with the client, and there's no content and nothing to it, and it makes it hard, I guess, to get any kind of feeling of what the other providers need. And we have primary care providers who do the same thing, that I'm sure that as counselors read their notes, they'll start to see that sometimes we get a little too cut and paste. Make sure that your documentation is clear, that another professional who reads it knows what you were thinking.
Well, thank you very much for your time.
Thank you.
Appreciate it. Thanks.